Hello, my name is Neosha Arthur. I am the therapist for Clara Williams, a 27-year-old female who has been referred to me by her psychiatrist. She has a diagnosis of bipolar I disorder, and Clara's here to see me because we are going to work together through a treatment plan for her, especially a pharmacological one. She wants to know what her future really entails and how to manage medication and treatment and to treat her disorder. So with bipolar patients, the first line of treatment is medication. And it's predominantly because 50 to 70% of bipolar patients have psychotic features, and what is DSM-5 classifies bipolar disorder 1 as is having episodes of mania and episodes of depression within a 1 to 2 week period that is consistent. Mania, in Clara's case, is she has extreme high highs, and then with depression she has extreme low lows, and it's extreme because we all experience elation and joy and happiness, and we get a boost of energy and we get our work done. But this form of mania, especially with Clara, it's causing her some concern, feeling that she is being an irresponsible mother. She's driving recklessly with her 2 children in the back seat of the car. She is making poor financial decisions for the family. She gambled a lot of money recently at a blackjack table at a casino near her home. It was money that was in their savings account for the kids' college. What else? She has flight ideas. She speaks really fast, doesn't make sense. And then that'll go for a whole week, sometimes 2, and then she'll have an entire week or 2 of depression, and extreme depression, where she doesn't want to get out of bed and she loses her appetite. And she said that she's not sleeping, she has insomnia, and she has no pleasure in everyday activities, even basically hanging out with her children or her husband. So this pendulum of extremity, high and low, caused concern. She went and saw her primary physician, who then referred her to a psychiatrist, and the psychiatrist put her on lithium. Now, lithium is the first line of medication used. It is the most common, it is effective, and it is very well known. So she's on lithium. Lithium is an anti-manic class drug, and that's exactly what it does. It manages manic depressive episodes. Initially, it takes 4 to 5 days to kick in, up to 3 months sometimes with some patients. It really depends on their blood levels. And I know initially, to start off, Clara was put on 1,200 to 1,400 milligrams a day until she stabilizes. And once she's stabilized, we can bring her down to about 700 milligrams a day. So this is a lifestyle change for Clara. This is her life, her future. And so there needs to be management and regular monitoring of blood work, to closely monitor her blood levels, and to manage the side effects. Initially, while Clara is on her 1,200 to 1,400 milligrams a day, she should be getting blood work every 3 to 7 days, and then routine checkups 1 to 3 months. If at any point her dosages are changed, she needs to have an immediate blood panel done. And if we're interacting any form of other medication, like an antipsychotic or an anti-anxiety, again, another blood panel needs to be done. So some of the side effects, and I explained this to Clara, that she should expect, and they are normal even though they seem pretty extreme. we have hair loss and acne, increased desire to go to the bathroom and urinate, maybe mild hand tremors, weight gain because it affects the thyroids, sensitivity to cold, mild diarrhea. It can also affect the kidneys. This is why patients on lithium feel thirsty all the time. It's the sodium levels that are in the medication. These are all normal side effects. Not normal is confusion, dizziness, seizures, loss of appetite, excessive diarrhea, excessive urination, heartbeat, irregular heartbeat, fast heartbeat, slurred speech, trembling. These are not normal, and medical attention needs to be sought after immediately if those are noticed. There are other drugs that can interact with lithium, antipsychotics, and there is actually a combination of drugs that Clara may have to go on, because sometimes side effects of lithium for bipolar can cause anxiety and or psychosis. So there might be some other medications that will be incorporated into her routine. In case Clara's wondering how long she needs to be on medication for or treatment, this is a lifelong change. This is for life. And unfortunately, patients who are bipolar, when they do come off the medication, they can relapse. So in order not to have any episodes of mania and depressive episodes, Clara needs to remain on the medication. As an MFT, I'm here to support Clara with managing her medication, making sure the side effects are manageable. And, once she is stabilized, we can start some psychodynamic therapy with her. My choice would be cognitive behavioral therapy, by Aaron Beck, because it helps with depression. Aaron Beck basically wanted to have patients who have depression replace their negative thoughts with more positive ones. And so CBT and a third wave of CBT, which is mindfulness, I feel would be really good to use for Clara for her improvement and quality of life. And part of mindfulness is meditation, which also is wonderful to do for depression. So hopefully with the medication she's on and some CBT and mindfulness therapy, we can help Clara manage her bipolar I disorder.